Last week, we had the honor of spending 6 hours with managers, directors, and staff development coordinators across about 3 states to help them better understand clinical judgment and, most importantly, how do they teach their clinicians clinical judgment and how do they hold them accountable to ensure that they are not missing cues and not properly prioritizing what interventions need to take place to improve the quality of patient care. Welcome back, everybody, to Dr. Sellers Educators. If this is the first time that you are joining us, this is a channel that you want to subscribe to. Every single week, we release a new snapshot that is directly aligned with our NLN nurse educator competencies. And if you're not a nurse educator, it's okay. It's great for you to be here too. We know that by title, we may not be nurse educators, but all of us are responsible for educating our patients, our family, sometimes it's our family members, and as well as our colleagues. Okay, so make sure that you subscribe to this channel so you will be updated every single time a new episode is released, which usually happens every week. So clinical judgment, that's what we started talking about last week. We released a couple of reels just highlighting some of the key takeaways that we gathered from about 60 leaders that were in the room over the course of 2 days. It was a very engaging conversation. I always learn from the people in the room. So I highly encourage you, if you haven't already adopted this practice, make sure you engage with your audience by finding out who's in the room. Now, I use just a short survey. Usually it's about 6 questions or so. I'm going to share some of the data that I look at to determine who's in the room. But when I think about how I'm going to craft my curriculum, a lot of it does stem from who's in the room. Me and a colleague, we mapped out the curriculum. And this was the first question we kind of talked through is, okay, what model do we want to use? What framework? We quickly decided to use the NCSBN model for a couple of different reasons. But first and foremost, we know that there has been consistent data that has been released to align with our nursing practices that are used in the clinical space and the NCSBN clinical judgment model, even though we realize that the model is really based on the new graduate is still very pertinent information, a very relevant model when we think about how we teach and really reinforce our clinicians about the steps they should follow to ensure they are utilizing clinical judgment skills. Okay, so first, let's look at a couple of statistics. I always like starting there to kind of level set to increase awareness. So 126. That sounds like a lot, right? That's the number of assessment skills that were taught in a pre-licensure nursing health assessment course, okay? And guess how many of those skills are actually used? 30, okay? And this is data that I'm gonna share the citation for you in just a second. But one other alarming statistics is 33%. What do you think that number represents? Go ahead and write it down. If you haven't already, print out your study worksheet, okay? Because I want you every single time you show up for a snapshot, write down today's date, whatever date you're watching this snapshot, and what objective you have. So what is it that you want to walk away with at the end of our time together today? All right, and 33%, if you've had a chance to write what number you think that represents on your paper. Now, this is pretty alarming. I want to read it out verbatim from the actual article. The result of this study showed that the outcome surveys were completed by second semester faculty prior to course adjustment, so they made some revisions to their course based on the 30 skills that were actually utilized by nurses compared to the 126 that were included in that skills checklist. But prior to course adjustments, 33% of students did not meet the benchmark. That's alarming. So 33% of the students were not able to competently demonstrate the skills on the checklist. Okay, so we know a shift has to come, right? Changes have to be made. This is the citation of the article that I am pulling this data from. Okay, so I encourage you to take a look at this data. Look at what interventions they move forward with to help ensure that we weren't missing the mark, that we were equipping our nursing students with the skills they needed in order for them to be able to demonstrate and integrate clinical judgment, decision-making skills in the clinical setting. Okay, so highly encourage you to take a look at that article. What else do we know about clinical judgment? Well, NCSBN shared with us in 2018, clinical judgment is linked to 46% of tasks that are performed by entry-level nurses. Well, you know what else? And this data I didn't include, and this is by Kavanaugh and Sweta that I've mentioned a couple of times, that 23% of new nursing graduates were safely able to recognize urgent changes in patient condition, identify appropriate responses to manage critical changes in a patient's condition. Now, that was from 2017. And the data hasn't changed a whole lot since then. So what can we do? I want you to think about it. As nurse educator colleagues, we know this is a big part of our responsibility. I want you to pull out a white piece of paper, and I want you to draw a line. Okay, this is a separate piece of paper. I want you to draw a line on the left-hand side. I want you to write down all of the teaching strategies that you've integrated into your curriculum, into your course, that are going to help support the student's development of clinical judgment skills, okay? And then on the right-hand side, what I want you to write down is, what are the missing parts? So maybe you already know that there are some additional skills that students need help with, right? Or that we need to reinforce in our curriculum. So the left-hand side is what you're already doing a good job at when it comes to helping students develop those skills. And on the right-hand side, what are our missed opportunities? I want you to commit to the left-hand side having more items on the list than the right-hand side, okay? And remember that this journey to being a better nurse educator, whether you're on the journey for CNE, you already have your CNE, or you're thinking about the CNE, hopefully, our goal is that we will equip you with content right here on our channel to help you become a better nurse educator, and ultimately to help our patients receive better care. That's why we're all here. That's what this journey is all about. What are our values? This is an exercise that I had the audience engage in. This is the younger Bridget, and I knew at the early age of 3 that I wanted to be a nurse. I wanted to be a nurse because my mother had a nurse when she was in the hospital having surgery. She had a nurse that left a huge impression on me. How many of us can attest to that, right? When you think about why we want to become a nurse, oftentimes it's a family member getting sick or someone that had a huge impact on our experience with the nurse or in the healthcare setting. And so younger Bridget knew she wanted to be a nurse. What I saw in that nurse caring for my mom that really sparked that interest, number one, her caring behaviors. What did that look like? She acknowledged me. As a young child coming into the room, worried about my mom, she acknowledged me as a child. She asked me who I was. She asked me how old I was. And she asked me about my mom. The second caring behavior that she demonstrated was she gave me chocolate milk. And I'll never forget that because chocolate milk was my favorite drink. And so that left a positive image that I had about nursing. Number one, nurses communicate really well because she asked me about what I was interested in. She wanted to know more about me. And second of all, she wanted to ensure my needs were met. So what values do we have as a nurse educator? How do they show up in the classroom? How do we reinforce those caring behaviors that are important, as we know, in practicing as a nurse? Jane Watson is one of my favorite theorists. All of my students that I've taught know that. I love to teach theory. But one of the reasons why I still believe is because the impression that the nurse left on me more now than 45 years ago. All right, so what do we think about clinical judgment? Well, first of all, critical thinking is sometimes used synonymously with clinical judgment. Are there aspects of critical thinking that are involved in clinical judgment? Absolutely, but they're not the same. What about clinical reasoning? Clinical judgment is not the same. Are there some key elements associated with clinical reasoning that are aligned with clinical judgment? Absolutely. But clinical judgment is more broad, okay? When we think about the care that we provide, it's a more broad perspective about our decision making in the clinical setting, okay? So think about what is the definition of clinical judgment and how does it show up? How does the development of clinical judgment skills show up in my curriculum? Now let's talk about data that I collected. A key step in the process when we have any type of interaction with the community, it's a collaborative effort for us to transfer the knowledge that we have based on our prior experience, based on the content that we've reviewed, Our job is that we're transferring that knowledge. We want teaching to synonymously happen with learning, right? So what did I want to know about my group? I want to know who's in the room. First and foremost, how many years of nursing experience do you have? Okay, so I used a very short survey. I like to use Google surveys, and so that's what I used. And the Google form gave me this data, gave me this beautiful chart. So I highly encourage you to use Google document, or you can use whatever your university provides. Okay, but I encourage you to find out who's in the room anytime you're engaging with learners. That includes our students. We know that a learning styles inventory or a VARC assessment, that allows us to see our students' teaching or learning styles, and that's going to help us to design our teaching strategies. Okay, so why did I want to know the years of experience? Well, that helped me identify two things. Number one, I wanted to make sure that I was coming from a place of relatability. I saw that I had 15.2% of nurses in the room that have less than 5 years of experience. So what does that mean? I'm thinking Bloom's taxonomy. I'm thinking going back to that lowest level of comprehension. When I look at NCSBN model of clinical judgment, I want to realize that that application and analysis level, some of my colleagues in the room may struggle a little bit with that. So I wanted to engage in application and analysis very quickly to bring along these 5 years of experience nurses that may be in the room. And perhaps they did have a high level of application and analysis, but what research tells us is that experience is the best teacher. What else did I find out from this data? Look at this point. 57, more than half of the nurses in the room have more than 10 years of experience. So that's the second key element right away. I said, oh, I'm going to have some experience in the room. I want to be able to leverage that, right? Because my 10-year plus experienced nurses would tune out very quickly if I'm talking a lot about basic information. So I want to meet in the middle. Well, how did I do that? Two things I did. Well, there were many things I did, but two key pieces of the curriculum that we planned to incorporate with our learners in the room. First and foremost is case studies. First and foremost was case studies. So I wanted to make sure with my learners in the room that I found out what scenarios they were experiencing related to clinical judgment. So I asked them the question, share at least 3 scenarios with me, maybe one that was a great outcome and 2 that weren't as much, okay? And we use those scenarios in the classroom as an unfolding case study. Second resource we used was this Josie King story, okay? How many of us are familiar with Josie King's story? Okay, I'm sure that I see some hands, right? I see some hands because it's a very popular story, very sad story, and I could not believe that that happened in 2001. How many of us feel like it was just a couple years ago? It left an indelible mark on each of us as a clinician, but certainly as a nurse educator. So with Josie King's story, if you haven't heard about it, I highly encourage you to take a look at her story and to integrate that into your teaching strategy. And unfortunately, there are many examples that can be used to integrate the clinical judgment skills into the didactic setting and into the skills lab simulation setting. Okay, but pick one and integrate it. The Johns Hopkins Hospital admitted Josie King on January 30, 2001. Her 18-month-old body covered in second-degree burns from a bathtub accident. This is a hyperlink that I used to show the shorter version. You can see it was only 5 minutes on YouTube. And so I encourage you to use the shorter version, or if you have time, use the larger version, the longer version, to ensure that the takeaway from the audience, from your nursing students, is that they are fully able to comprehend the impact of making clinical decisions in a way that's going to result in a positive outcome. It takes comprehension of concepts, it takes doing a proper assessment, following a framework, highly recommend SBAR, but making sure that there's a framework and how we communicate to our providers about urgent patient care needs. Okay, so let's take a look at our thought-provoking question as we wrap up our time together. So consider the following patient scenario. A 65-year-old male patient with a history of diabetes and hypertension is admitted to the med-surg unit with complaints of chest pain and shortness of breath. As a nurse educator, you are supervising a student nurse who is caring for this patient. In this context, how does the nurse educator's nursing experience contribute to the development of clinical judgment in the student nurse? Now, this is a really good one, because what does Boyer's model tell us? Well, we have to have the clinical experience and expertise in order to effectively teach our students. That's also what the Board of Nursing says. Okay, so this aligns directly with what we know the evidence says we should follow. All right, so let's take a look at the three choices. We have A, describe the steps the nurse educator should take to guide the student nurse in assessing and managing the patient's condition, highlighting the importance of nursing experience in clinical decision making. B, compare and contrast the approaches of the nurse educator and the student nurse in assessing and managing the patient's condition, emphasizing the role of nursing experience in shaping clinical judgment. Or C, explain the theoretical concepts of clinical judgment and nursing experience, illustrating their application relevant to the patient scenario, and discuss how the nurse educator can effectively transmit this knowledge to the student nurse. Okay, so again, the question is, in this context, based on the scenario, how does the nurse educator's nursing experience contribute to the development of clinical judgment in the student nurse? Okay, and this is what we're talking about. If we're not the expert as it relates to helping students develop clinical judgment skills, we want to do two things. Number one, partner with a colleague that is. And second of all, look at the evidence, be a student, so that we can advance our knowledge, skills, and ability in order to better equip our students with the development of the clinical judgment skills that they need. All right, so what is clinical judgment? Think about one word. This was actually an activity that we did using Poll Everywhere. A great way to engage our adult learners, as we know, is through using an audience response system, also known as ARS. Well, this is what we know. The definition of clinical judgment, it is the outcome of the clinical reasoning process using cognition, metacognition, and clinical knowledge. It requires all three. The second descriptor is that we make a conclusion about a patient's needs, concerns, or health problems when we follow clinical judgment. Students aren't able to do some of those fundamental health assessment components, then they're going to struggle in advancing their skills to be able to make the best patient decisions and recommendations for our patients' outcomes. All right, so if you chose A, give yourselves a round of applause for the thought-provoking question. You are correct. You want to be able to describe the steps the nurse educator should take to guide the student nurse in assessing and managing the patient's condition, highlighting the importance of nursing experience in clinical decision making. But if we don't have that experience as a nurse educator ourselves, it's going to be really hard for us to be able to demonstrate those key steps and describe them to the nursing student, and ultimately giving them that formative feedback that's going to help them advance their skills as well as their knowledge in an effort to achieve the highest level of clinical judgment, where we merge the two. Okay, when we look at NCSBN model, we look at the client needs and we look at the client outcomes, and we want to make sure that both are satisfied in an effort to provide the best patient care. All right, so I know this was a lot. This was step one for our journey as we move forward and looking at key elements related to the clinical judgment model and why it's so important. So we're looking at the why, the what, and the how, and the when, all four of those elements as we continue just to show up better tomorrow than we did today in our classrooms. And just remember, this quote by Nelson Mandela is very relevant as we wrap up this snapshot. The greatest glory in living lies not in ever falling, but in rising every time we fall. We appreciate you joining us for this very important snapshot. Make sure that you check out our website, drsoleseducate.com. That's where you're going to find resources to support you on your journey to achieve nurse educator excellence. Until next time, have a great one, everybody.